Question. A 28-year-old male presents with fatigue, pallor, and shortness of breath on exertion. He has a history of Crohn's disease, managed with infliximab. Laboratory findings reveal the following. Hemoglobin, 8.5 g/dl, low. Mean corpuscular volume, MCV 72 FL, low. Serum ferritin, 8 nanograms per milliliter, low. Total iron binding capacity, TIBC 460 μg/dl, high. Serum iron, 25 μg/dl, low. Which of the following is the most likely cause of the patient's anemia? A. Anemia of chronic disease. B. Iron deficiency anemia. C. Vitamin B12 deficiency. D. Hemolytic anemia. E. Thalassemia minor. Correct answer is B. Iron deficiency anemia. The patient presents with microcytic anemia, MCV less than 80 FL, and the laboratory findings confirm the diagnosis of iron deficiency anemia, which is the most common cause of microcytic anemia. Key findings supporting this diagnosis. Low ferritin. Ferritin reflects body iron stores. A low level, 8 nanograms per milliliter, is diagnostic of iron deficiency anemia unless there is coexisting inflammation. Elevated TIBC. Iron deficiency leads to increased production of transferrin, resulting in a higher TIBC. Low serum iron. Indicates depleted circulating iron levels. History of Crohn's disease. Crohn's disease often causes chronic blood loss, e.g., from gastrointestinal bleeding due to ulcers or strictures, and impaired iron absorption from the inflamed intestinal mucosa. Why not the other options? A. Anemia of chronic disease. In anemia of chronic disease, ferritin levels are typically normal or elevated due to iron sequestration, and TIBC is typically low. This does not align with the findings here. C. Vitamin B12 deficiency. Vitamin B12 deficiency causes macrocytic anemia, MCV greater than 100 FL, often with neurological symptoms, e.g., paresthesias, ataxia, which are absent in this patient. D. Hemolytic anemia. Hemolysis is associated with elevated respiratory count, indirect bilirubin, and lactate dehydrogenase, LDH, none of which are mentioned in this case. Additionally, hemolytic anemia is typically normocytic. E. Thalassemia minor. Thalassemia minor is a cause of microcytic anemia but does not typically result in low ferritin or elevated TIBC. A history of anemia from childhood or a family history is often present, which is not mentioned here. Key learning points. Iron deficiency anemia is characterized by low hemoglobin, MCV, serum ferritin, and serum iron. Elevated TIBC as the body attempts to increase iron transport. Chronic gastrointestinal conditions, like Crohn's disease, can lead to iron deficiency anemia due to chronic blood loss and malabsorption. Distinguishing iron deficiency anemia from anemia of chronic disease relies on ferritin and TIBC levels.